Okay. Hello, everyone. So today we have the pleasure to have Professor Nezih Altay here and Felipe Buzanovsky, and we are going to discuss about disruption in supply chain and the humanitarian field. And so Nezih is a professor in DePaul University in Chicago. He's a Fulbright and he is specialist in humanitarian operations. And Felipe is a humanitarian practitioner. He's a supply chain also, and he have many countries that he live in and different projects, different challenges. He's going to talk a little bit about that. He worked for Doctors Without Borders, World Food Program, and Médecins du Monde. So it's with you, Nezih.
All right. Well, thank you, Renata, and thank you everyone for first of all inviting me to talk with you. And also, it's an honor to be here on the same Zoom with Felipe. I always respect, humanitarian workers and their soldiers. And Felipe has been working with the organizations that we have utmost respect in terms of being always everywhere, like MSF and World Food Program. So I don't claim to have his experience, but my knowledge is more theoretical. As Renata said, I'm a researcher of humanitarian operations and humanitarian supply chain management. I'm a professor in the business school at DePaul. So my field is supply chain management in terms of teaching, but I focus on humanitarian logistics and humanitarian supply chains as my research goes. And I've been doing this research on this topic basically the last 20 years. I can't believe it's already 20 years. So what I want to talk about is Renata gave me some questions when she approached me, and she was interested to hear environmental and public health impacts of supply chain disruptions, how these disruptions or interruptions affect food systems, and the critical role of humanitarian operations in mitigating these challenges. So I want to just to give you a short glimpse basically of supply chain management, global logistics, and humanitarian operations. So supply chain disruptions, there's a huge literature on that. And what's interesting about it is we tend to focus on the supply end in terms of supply chain disruptions. And so what's a supply chain disruption? Basically, your supplier doesn't show up one day, right? So if you were, for example, distributing maize or rice to people in need in refugee camps or somewhere else, and your rice supplier doesn't show up, or your rice supply just dries out, that would be a supply chain disruption. Another supply chain disruption is the supply is there, you cannot reach it. So basically, the transportation link between them can be disrupted. For example, in the United States, recently we were at the brink of a port workers strike on the south and southeast sides of the United States. All the ports in the south and southeast and east of the United States, port workers were about to strike and negotiate a new contract. And everybody here in the US were panicking because if the ports in the East Coast close, then everything needs to be rerouted to the West Coast. But then, the West Coast ports are already full. So there's going to be a queue and everything will be delayed. And of course, you can also imagine that the costs will increase. So that's another supply chain disruption where the linkages between the nodes basically are disrupted. And the reason I said, there's a big literature on supply chain disruptions and they focus on the supply side. For the first time with COVID, we found that the demand side can be also disrupted. So that was unexpected for us researchers, right? We didn't research that well. And with COVID, what happened is when everybody went home, the demand for certain items just disappeared. Demand for certain items, as you all remember, we had a shortage of toilet paper. There was a toilet paper panic, right? Demand for certain items went through the roof, whereas demand for other items went really to zero. And that created havoc in supply chains, global supply chains, and food systems too. When people stopped going to restaurants, restaurants stopped buying food. So growers of food could not get rid of or sell their products. I witnessed firsthand a chicken farmer gas 60,000 chickens because he didn't have anywhere to sell them. And then those chickens were basically just buried. I've seen pig farmers who couldn't sell their pigs to slaughterhouses because slaughterhouses were closed. So there were nowhere to slaughter the pig and sell the pork. And apparently, I didn't know this. There's an optimal weight for a pig to be sold in the meat market. So the pig basically kept growing, and they were unsellable. And the farmers basically executed them because they were too expensive to feed. So again, the problem was all these chickens, all these pigs were killed, but they had to be either burnt or buried because moving them to other markets where they were needed were much more expensive than just burying them. So all that effort, all those resources to grow them went out the window. Same thing happened with potatoes. When people stopped going to McDonald's, McDonald's is the world's largest buyer of potatoes and ground beef. And all those potatoes in, what is it, Iowa, I think? Idaho. There were mountains of potatoes, basically, that the potatoes farmers could not sell because McDonald's stopped buying them. And they didn't know what to do with it, and moving them was expensive. So basically, they told people, here's a mountain of potatoes, come get it. But I'm not going to drive from Illinois to Idaho to get, a sack of potatoes. So they went bad. So those are the impacts of supply chain disruptions on the food systems. And you also asked me to explain, what humanitarians can do. I think there is a big potential for humanitarians to help with these disruptions and environmental and food system impacts. And the one thing we can do is capacity building. One of the reasons, during COVID, all these food items went bad was because food grows locally, but is distributed globally, right? So when the supply chain breaks down, food in one location cannot be distributed to another location. That's the problem with supply chain. Supply chain is basically the logistics function of the world, right? So what we need to do then is capacity building in local markets. So when one market is unreachable for any reason, whether it's a transportation problem or port problem or supply problem, then the local capacity can sustain the humans or the vulnerable populations at least. So there needs to be, however, a prioritization scheme there, because if we had enough local capacity in each location, then we don't need globalization, right? Or the global or the global shipments of food. But of course, once you're used to eating strawberries 12 months a day, 12 months a year, right? And we tend to forget in the United States, for example, that food is seasonal because food is available in every season in our markets. And they don't taste the same, but they are available. So that creates the idea of is the capacity, local capacity, enough? And if it's not, how can we prioritize that local capacity to satisfy the needs of the vulnerable? And the second thing is similar to capacity building is localization of aid. We move a lot of aid around, and I'm going to give you one example, and Felipe can talk about it more. There's a standard bucket that I believe Oxfam designed years ago. And that bucket is designed so that there's, when you do plastic molding, injection molding, when you're removing the bucket, the bottom of it basically creates this little extension of plastic. And when you put it on your head, it hurts your head. because it's like a little needle coming out. So Oxfam redesigned this bucket and created a mold where that doesn't happen, so that you can actually carry the bucket on your head. Well, that's all great, right? I mean, and basically a redesigned bucket is sounding great. The problem is we produce that bucket in one or two factories in the world. We store that bucket in, I believe, four United Nations warehouses, in Panama, Dubai, and I forget the other two. And then when an earthquake hit Nepal, we moved those buckets. We basically moved them from Dubai or Panama to Nepal. It's a very simple bucket that's going to cost less than $1 to make if you have the mold and the facility in Nepal. But we have to move it around the world so that, a couple of dollars worth of bucket comes down to, somebody calculated it, something like $42 because of the storage and the movement and all that. And I'm not even talking about the carbon footprint you're creating, right? Flying them or moving them around. So I think local capacity building and localization of aid can alleviate these problems. If you have more suppliers around the world, you basically create buffer and resilience in your supply systems. But we tend to do the opposite, to cut cost, to minimize cost. We tend to have one or two suppliers around the world because they have economies of scale, but then we have to ship it from one location to the world, which creates a lot of carbon dioxide, right? So creating local capacity, localization of aid, localization of resources can actually alleviate all these problems from a environmental impact perspective, as well as reaching vulnerable populations faster. So let me stop there, Renata. I don't want to take the whole day. And give some word also to Felipe, and I'm really curious to listen to his perspective on this. You're muted.
I'm sorry. Yeah, that's perfect. And then after Felipe, we open for questions because I already have a lot. Yeah.
Okay. First of all, thanks very much, Renata, for inviting it, Professor. And it's an honor to share with you this discussion. I think that you covered a lot of very important aspects that we have. It's possible to observe, especially with all your know-how in the supply chain. It's very pertinent for the topic. I want to bring, and I don't want to go too deep on some of the details that you mentioned, but of course they are all super important. I want to come first with some examples of also to sustain as well your topics, because I think they are quite nice. When we were talking about, for instance, the strike on the ports in the US, and I have faced similar when I was in Bena, participating in a vaccination campaign. And most, I don't know if all our audience knows, but when you're talking about vaccination campaigns, there is a lot involved in cold chain, and a lot of countries, you don't have the capacity, you don't have electrical means or power, and you have to be quite well prepared in terms of cold chain to keep on that. This vaccination campaign was in Niger, and I know Renata has been in Niger as well, but in lots of clinics that we worked together, they didn't have even a generator, so their fridges were gas powered fridges with very, very small thermal capacity. And we made an order for this vaccination campaign that was supposed to arrive in Ghana and drive through to Niger, and it didn't make it because they were on strike in Cotonou port. So we had to resource for other means. And that's just an example of kind of not controlled impacts that can definitely disrupt our supply chains, even in this case, in the supply side. also, I think that the topic that Professor mentioned on localization and capacity building is super, super important. I have worked in World Food Program, and I remember a lot of initiatives, and I think that is one of their goals is to try to have as much as possible buying from local farmers or local production. However, there is also need to have a balance. Of course, it's important for the organization to buy, but there is also a thin line in terms of how much they are buying, how much they influence the local market, and they can take over all the local market in an organization like World Food Program. So it's I think that it's a super topic on how to find this best balance. But I know that they have. They preferred as much as possible buying locally. When I was when the Russia-Ukraine conflict raised up, I was one of the first to arrive with WFP in Romania, and we started buying from a local market or from close countries around, like from Turkey, Bulgaria, even from Romania to ship inside Ukraine. But this had to change very fast as well. On the other hand, because Ukraine is a big grain producer. It's one of Europe's biggest countries with best agriculture in a way. So it started with shipping from abroad, but then it started to try to how to use the local market that is still functional in terms of local supply. And after that, it came. I don't know if you remember, but the Black Sea Grain Initiative that Ukraine, in agreement between Turkey, Ukraine, and Russia with the UN, they started shipping the grains from Ukraine into Turkey, and these grains were then milled and sent to Afghanistan. So not localized in a way, but the importance also on knowing very well the supply chain and how to better take advantage in terms of the where the food is produced and how to reach the most needed markets. So I think that's is localization is super important, but there are also some constraints. Also, and when we talk about the conflicts that are turning around and happening here and there, that also harms even the local production, that access to food or to other products, and that is also an impact related to not only environmental but the context that we have been working and the part of the disruptions that the supply chain faces. So I think that comes also a big paradox in terms of how to decentralize and how to keep the supply chain strong enough to absorb the shocks on the decentralization and still to keep functional and resilient to cover the needs. So it's I don't have an answer, of course. That's a $1 million or $1 billion question, but it's also part of all the way that we have to think on how to make it supply chains as strong as possible or as more strong to support to these shocks. I think that Renata has a face that she was willing to add something, but
No, I think it's great, this discussion. As you said, there's no right answer. But one thing I think everybody agrees is how dynamic is this supply chain, because it can change very fast and all the operations have to turn around and okay, now we are going to rethink about that because the thoughts that we had yesterday, it doesn't work anymore. So I think that this fast decision is one thing that it's really strong for me when I think about humanitarian supply chain. That changes the professionals need so much flexibility and open mind, like that's
yeah. If I can just add something, Renata, and also take the point that Professor Nezih was mentioning before, when COVID started, not only the toilet paper, but I remember also the crazy for the disinfectant gel that people were looking everywhere, and how many supply chains were especially disrupted and affected because a lot of production was in China, and what was the impact of having so much containers moving to China, and then they had a gap of containers in other markets, and people not being able to import from China anymore, or the close of the different markets, and how that impacted the whole supply chain that we all know how we lived in. It seems that it was quite a long ago, but it was less than a decade before. But it was such an impact in terms of how to think, also as well as in opposing with the. I think that in the last decades that people have been trying to make a lean supply chain as more just in time or more efficient as possible, but how this contrasts with the resilience that we have to be able to answer to these unexpected events.
Yeah, can I join to that, add to that, Renata?
Please.
You're absolutely right, Felipe. I think, before COVID, the world, production world especially, was going very much lean. And that was cost minimization focus and keep very little inventory. And, that way we can buy everything much cheaper. But then COVID came and we realized that, lean doesn't have any buffer. Lean doesn't have any backup. Lean also, one of the things in lean philosophy is that each item is sourced from one supplier. So you're really putting all your eggs in one basket. From a preparedness perspective or resilience perspective, lean doesn't make any sense. However, from a cost perspective, it makes perfect sense. And I think we forgot that, Mother Nature has other plans. And we were assuming that everything will continue without any disruptions, any issues, any interruptions, and all that stuff. Now, of course, the whole academia, we're also in practice, we're discussing what is the right balance between resilience and lean, because we still want to need, from a business perspective at least, the affordability of the product, right? Food and, your phone or whatever. But also, from a disruption or supply chain management perspective, we want to build resilience in our systems because we don't want to go through another COVID. And are we going to have another pandemic? Absolutely. When? I don't know. But we should be ready. And of course, human brain or human memory is, I always joke about it. Humans have the memory of a goldfish. In 30 seconds, basically, we forget, right? And look at what's happening in the business world today. They're still behaving as if COVID never happened. So instead of building on resilience, we're going back towards cost minimization and all that stuff. The other thing I want to mention that
back
Felipe
to normal, no?
yes,
To
back to
normal. Oh my God.
whatever that normal is. We don't realize that that normal has changed. We have a new normal. Felipe touched upon the localization is great, but then there's also capacity. And when you're coming in as a giant like World Food Program, for example, into a market, and you're bringing food from outside to the local market, you really change the balances in economic balances in that marketplace. And I've seen this in 2010 in the Haiti earthquake response. There's a chicken company in the United States. It's one of the largest chicken producers in the US, Perdue Chicken, Perdue, Perdue Chicken. And Perdue at the time basically said, we're donating a bunch of frozen chicken to Haiti. And well, back then, there was also a lot of chicken farmers in Haiti. They were small scale farmers, but they are, growing chicken and selling to the marketplace. Well, when the US came in with free chicken, who would pay money to buy chicken? So basically the free chicken donated by Perdue, the free frozen chicken, just killed the chicken farmers' income. So it killed the economy, or chicken economy rather, in Haiti, at least temporarily, right, during the response phase. And we have to think about these things. because as I said before, like when COVID came and demand ended, people over here were gassing their chicken, killing their chicken because they can't sell them, and feeding them was more costlier. Well, at least here in the US, these gigantic chicken farms have the means to survive, right? They have access to loans, they have access to financing and all that stuff. And small scale farmers in developing countries or poor countries like Haiti do not, right? They don't have access to these buffers or backup scenarios, insurance, and such things like that, right? So here, for example, we have something called business disruption insurance. So I can buy that insurance, and if I have disruption in my business, the insurance company gives me money to survive. The Haitian chicken farmers don't have access to that. So when we're coming in with donated food or donated items, we need to be very sensitive and aware of what we're doing to the local market. And you're absolutely right, Felipe. There's a lot of research on this, and there's a balance to this, but it's context dependent. So the problem with calculating these balances is you need to collect the data and do your optimization. There's a lot of game theoretic models on this that sets the price, right? And then offer the aid maybe with a low price so that it doesn't kill the local market. Now, this takes time. And when you're responding to a disaster, you don't have that time. So as I mentioned earlier, I see a lot of AI on the Zoom, right? And that's where AI comes in, because AI actually can calculate all this based on the contextual differences if we train the AI properly, right? And then when you're coming in, you already have the answers. But if you actually go there, start collecting the data, and then calculate and optimize and then decide, you're wasting precious time, weeks maybe, because collecting that data, cleaning that data takes a lot of time. Just to give you an idea, I'm involved in a food rescue project here in Chicago, and the organization I'm working with has data, right? I'm using the air quotations for has data because it took us, me and one student, 10 weeks to clean their data. 10 weeks just to clean their data so that we can actually do optimization. So just the fact that an organization has data doesn't necessarily mean we can use it. And I'm hoping that AI will accelerate all this so that we can, when we come in, we can make sense of the data that we have and then calculate something. Sorry, I shut up now.
No. I just wanted to add, Professor, as well, and you're definitely right on the topic. I was also mentioned on the other hand, when organizations like World Food Program also buy too much from local markets that leave the rest of the population without access to the local market, which is also another problem. Is it's either on the perspective of the producer, of the local producer, either on the beneficiary that after the local population that won't be able to buy because everything's already sold, so they have to reroute. So I think that there is also these two perspectives in terms of the local market, but definitely it's no doubt on the importance of working on improving the local capacity and but also the organizations like UN or that has a big purchase power or buying very big volumes, how they can affect the balance either for the beneficiaries or for the price or for the local production. So all this makes part of the full equation on how to better manage this food production, food chain.
Yep, absolutely.
And I remember during the COVID, one thing that surprised me was how difficult it was for the organizations to bring people and team to the projects, because all the borders were closed. So, where you were, you stayed. So it was really hard for people to leave the projects, even if their term was expired, and also to achieve new projects, because we were always stuck in no visas, no nothing. The borders were closed. I think this is another challenge that it's it's part of the supply chain, but we talk more about things than people. And so it was a hard challenge, I remember that. And also
Do you remember?
yeah, say.
No, sorry to disrupt. But do you remember that during the COVID times, UN was the biggest airline in the world for a while? Because they was the only ones that were flying. It's a division from WFP, the United Nations Humanitarian Air Service, where there was for, I don't know, for a couple of days or weeks, but it was the main airliner in the world. This was the only one that was flying all over. Me, I remember when I left Chad to Armenia, the time that I was based there, it took me 5 days by plane from different hubs to arrive. So
Yeah, it was a hard time. Nobody understand very much in the beginning what was going on. Yeah. And about that, I remember a lot of things in the project, like when you see containers of used clothes, and that break the marketing, local marketing, because how you're going to sell even cheap clothes if it's for free, so this is hard. And another thing that I think it's a challenge too, is when those organizations need to close their projects because they are the biggest employee in the area in a lot of times. So when they leave the salaries too. So yeah, local
They
market.
leave a vacuum.
Oh, that I think that's the worst thing that can happen in a humanitarian operation is when suddenly we have to evacuate everybody and disrupt the mission in before it's over. I think this is a hard moment for everybody, for the ones who have to leave and for the ones who have to stay. So because it's never a good reason, so suddenly just close. And another thing I think it's important that I saw, it's money wise, like for example now with the conflict in Gaza, a lot of money that was supposed to go to different kind of operations. The money in Gaza is crazy, So, and also when we have earthquakes, that suddenly a lot of money come inside the organizations because a lot of donations happen. And it's not because we have money that we can grow the operation 2, 3, 10 times. It's more than money that is needed. But we are going to have we have a hands here. Olive. Olive is from Kenya. She's from Nairobi. She's our leader, a woman leader in Africa. So your question, Olive, please.
Okay, not really a question, but when you talked about the toilet paper tissue, the way everybody was running for it, for us it was hilarious.
It is hilarious. For everyone, it's hilarious.
Yes, in Africa, I mean, tissue, that would be the last thing in our mind. So I'm just thinking, have you thought of a solution or a substitute if something like that ever happened again?
A substitute to toilet paper, you mean?
Yeah. Seriously. Because in Africa, it's not a problem.
Yeah. But
They have
look,
substitute.
but okay, so your question is a trick question because by asking, is there a substitute for toilet paper, you're assuming that that behavior was rational, right? People do really need toilet paper, so we need a substitute. Number one, people don't need toilet paper. I grew up in Turkey, but I spent most of my time in the United States. But Turkey is a Muslim country, and in Turkey, for example, you wash yourself rather than using just the toilet paper. So the culture is very different, and the needs are different. But I think the toilet paper crisis was showing us how irrational people are, right? And if you have not read yet Daniel Kahneman's book, Thinking Fast, Thinking Slow, Think Fast, Think Slow. It's by Kahneman, and it's based on his 20 years worth of research on how humans make decisions and decision bias. Basically, Kahneman received the Nobel Economics Prize because he invented this, or he showed for the first time that the consumer is not rational. We always assumed that consumers were rational human beings and they would make the rational choice. And the toilet paper crisis, for example, is a great example for that, people are not rational. So that was just panic buying behavior. And I also tell you another thing for US consumers that is going to surprise you. There's a lot of research that shows when a hurricane approaches to the United States, right? People buy the first things that basically go out of stock in a supermarket when a hurricane is approaching is batteries, bread. That so much, so far so good, right? Makes sense. And beer. So the third one doesn't make sense. Like, are we basically, partying throughout the hurricane? What are we doing? So again, that's another example of not rational decision making, right? Unfortunately, humans are not that rational. Humans are not that smart. So I don't know what the substitute for the toilet paper will be.
Maybe
Thank you.
think about it. It's use your brain. Maybe this is the substitute. But so initially that was the idea to bring people to this discussion here. So every week we are bringing different topics, different specialists. And my idea was like, as we work with different countries around the world, and I started to face, like people say, oh, I have a local problem here. And when you realize, oh, this local problem is happening in Bangladesh, in Kenya, in Brazil, I say, it's local, but it's not local, when we start to see. And my question is, as we are facing more and more threats because of this climate change and thinking about what happened in COVID, so how can we create resilience in the community level? Because for the supply chain, we talk about global, everything is global, but in the community level, how can we bring more resilience to those people? Because when we talk about no rationality, like when COVID hits, I was like, oh, we don't have time enough to educate Americans about a crisis. And in Africa, they say, oh, okay, it's another pandemic. We are going to survive. They knew they would, what I mean? So how we approach those things without people freaking out or denying, like, oh, no, this is not going to happen. Like, stop talking about that, Like, so I would love to hear from Nezih and Felipe about that.
Do you want me to start first?
Yes, you can.
All right. So when you drive everywhere, you tend to forget to walk. And here in the US, for example, our food systems, look at our food systems. Even I live in Evanston, a suburb of Chicago, and the closest supermarket to me is 20-minute walk. And what I do is I drive there, right? So all these conveniences, unfortunately, our systems are designed also for these conveniences. So in other words, instead of, for example, I visited my friend in Barcelona last week, and there is a little kiosk downstairs of his apartment. There's another kiosk across the street on the corner of the street. So they never use a car. They don't have a car. They walk. They can buy their food and do their business just by 5 minutes walking everywhere. But city of Barcelona is designed that way. Whereas the city of, American cities, Chicago is probably an exception to the rule. Most American cities are not designed to be walkable. So you drive everywhere. And when you drive everywhere, you tend to forget that you could have walked or you could have taken a bicycle. What I'm trying to tell you is when you're used to a certain convenience, you tend to forget what it used to be like before, right? So we need to remind people that there is an alternative life. And when you cannot drive, like gasoline is not available, you can actually walk or you can actually take a bicycle. But the reaction of that irrational human being is when gasoline is not available, oh, I can't go anywhere. No, you have two legs, you can walk, but they're not thinking that way, right? So we need to remind them these other alternatives. And I think it comes down to education, right? I'm in the sector of education, so of course I have a bias. And so for me, all of the solutions to human problems are education. But the problem is, how do I get that idea out in a digestible format to the average Joe, right? Because when I write a paper about this, nobody reads an academic paper other than academics. Even practitioners don't read our papers, so we have to create an executive summary or something, make it more digestible, because the practitioner doesn't care about the methodological details and rigor and all that stuff, right? So we speak a certain language. We need to translate that language, just like, when I talk to an attorney, I don't understand half of the stuff he says in legalese, right? And the attorney makes it more digestible for me. Academics need to make the information more digestible for the average person on the street when we are educating them. The problem is we don't have an incentive to do that. Renata, you've been an academic before. We have this publish or perish methodology or logic, right? So if you don't publish in academic journals, you don't get tenure, you have to leave academia, et cetera, et cetera. Well, that means I have no incentive to translate my research to more digestible language for the average person to understand, right? So I don't get a bonus out of that. I don't get promotion out of that. I have zero incentive to do that. So that creates a problem, and it comes down basically to incentives. How do we incentivize our institutions, whether it's an academic institution, research institution, humanitarian institution? How do we incentivize our institutions so that we educate the average person on the street that they understand what happens when there's a shortage of toilet paper, or they understand what happens when there's a shortage of gasoline or something like that. So that's what I think.
I couldn't agree more, Professor, in terms of education. I think that everything passes through how do we transmit the message. It's, you reached I think, very, very strong point on that. And I'm not an academic, and I apologize if I cannot go too deep on this topic. But for me, it gives me also the impression on the role of the academia and how this integrates in terms of the civil society, or how this integrates in a participative way with the city, with the neighborhoods, and I don't know, Renata, maybe you know even better on your previous roles, on your previous job, and so on. I know zero about US, Nezih. I'm sorry on that, but I see in Brazil on the other side some universities sometimes trying to approach with the population in a way, or making different campaigns, or bringing the population inside the university in a way. And on the other hand, I think that passes also from maybe even the primary education, basic education, on how to change maybe what we have been teaching to children since the beginning, or how to approach. I think that is not only on the academia university level that we can think, but also how we have been bringing our children and preparing
different perspectives of the world. And of course, this is just like coming from my head. I have no scientific basis on my thoughts, but that's what makes think in a way on how to better integrate that in terms of the full educational and to complement the full education and make better people to a better future. So
yeah, it's not just a university problem, it's the whole education system. But I think also when people misunderstand, at least some people misunderstand what education means. They think that education is learning the facts of some context, right? And for example, now there's a change in the university education system in the United States. People are saying, like, why am I going to school for 4 years if I just want to be an accountant? So you can learn accountancy in 1 year. Why am I paying tuition for 3 more years? Well, the whole idea of university education is we teach you how to learn. So you learn how to learn, because learning never stops in life. So we're looking at it as like we're preparing you for the rest of your life, because learning will never stop. And then when you're out of the school, you will continue to learn. But if you don't know how to learn, you will be misguided by misinformation, which is plenty. You know, if you're learning from Instagram, there's a problem with that, right? Because we've been talking for 50 minutes now, and we just scratched the surface on this topic. And in Instagram, a reel is what, 20 seconds, 30 seconds. So you're not going to go in deep. And if you're getting your information from social media, there's a problem with that. But anyway, so that's a whole different session, Renata, the need of education and all that. And I see a couple of questions in the text box. And one thing Adila says, when there's a linkage disruption of healthcare services in a place like Afghanistan, where women are disproportionately affected by the policies of the current regime, I would be interested to hear Dr. Altay's views on this time. Well, Dr. Altay is helpless in that, Adila, because we can do all the research we want and optimize, healthcare systems, food systems, this and that. Ultimately, it comes down to governmental decisions, whether those health systems or food systems will reach to vulnerable populations. So the academician's job is to create research that leads or shapes policy. But as I always say, I can bring the I can bring the horse to the water, but I can't make the horse drink, right? So whether the horse will drink or not, that means whether the government will change its policy or not is a government decision. And, unfortunately in Afghanistan, first of all, I'm not a religious person. So the fact that someone can actually rule somebody else's life based on religious rules is completely against my belief system. So, I don't have an answer for you, unfortunately, because, I can't change the Taliban or how they view the world. So yeah, I'm helpless in that question. I don't know what Felipe thinks about that.
I'm helpless as well, as you said. I think that I totally agree in terms of whether a government or religious view impacts on this restriction to access to healthcare. I mean, it's just something. It's just pity to see that people that have different access just guided by this view. It's just, I would say, shame even, but it's I don't want to politicize the topic, but it's I mean, everyone should be able to access the same kind of services, and not, it's not shouldn't be different from my perspective, of course.
Yeah, I'm in agreement with you.
And
This
well, of course, the question was related to Afghanistan, but it doesn't happen just there. No, we saw here in the US, the president of the United States asked people to drink bleach. In Brazil, the president asked us to don't go vaccinate because that was a scam. So I think science and professors and academics have a ceiling, unfortunately, that we don't operate anymore. You know, that this above that, we can just suggest things, but
yeah.
not more than that. And if the people that are above and in the power don't listening,
Yeah.
it's
So
hard.
academicians by definition are thinkers, not doers necessarily. There are some academicians who actually do too, but when it comes to governmental policies, our reach is limited. And also, like, some academicians are, academia is very much like the soccer world. Some soccer players, like, in Brazil, for example, you have stars, right? They have more impact because of their star quality or star status. I'm not one of those. I'm, secondary league player. So I doubt that the United States president knows me or asks my opinion, but there are professors, there are academicians who are actually in the advisory council of the presidential office. So they have more pull, more voice. Um, there is another comment over there about academia. Somebody's poking me on academia and the professor being a dictator. I have one thing. I don't know where you're located, but I have one thing to say about that. In Turkey, for example, the education system is just like that. The professor is God. You don't question the professor.
Oh,
And I have a lot of students here in the US in our program from India, and they have the same culture. You don't question the professor. So now they told me that they are feeling as fish out of water because I asked their opinion, right? The education system here in the US is very different than India or Turkey, and I don't know about the rest of the world, where the information flows one way from professor to student, and there's no back return, right? And in the US, we actually tend to treat the classroom as a conversation rather than a one-way flow of information. So for my Indian students, for example, that's a culture shock. And they don't know how to handle that. So I do a lot of therapy sessions with them, talking about, like, you can tell me, you can ask me, you can tell me your opinions, you can ask me questions to challenge me. Or if I say A, you can say, why is it not B? And that's okay. And so I disagree with the idea of, the professor or the department chair being a dictator. By the way, my department chair doesn't have any power on me. I'm a tenured full professor in the United States, so I can do whatever I want.
that's awesome. And uh, I just have one. It's not a quick question, but I would like to ask this question for both of you. It's you both started a few years ago in the humanitarian field, and I think now it's more and more popular, but in the beginning it was not. I would love to understand, you are both engineers, so and I know engineers are not used to look at this side of how engineers are important in the humanitarian. Because, so how did you both get in this field?
So for me, it was a personal experience. I was getting married in Turkey in 1999, August. And 4 days before our wedding, earthquake hit. 17,000 people died. We survived. So for me, it was a personal experience that triggered my interest in humanitarian work. Before that, I was basically trained as a manufacturing planning, production planning person. My training is production planning and optimization. My undergrad is in chemical engineering. But when I experienced the earthquake and we didn't receive any help or any aid from anyone, Forget about, NGOs or government. Nobody came to ask, do you need water or anything for the next 4 days after the earthquake. That basically made me angry, and I started reading, like, there must be a better way of managing or responding to disasters. So I started reading disaster management. I educated myself on that, and since then I've been doing research on humanitarian issues. And the disaster led to other humanitarian problems like development aid, sex trafficking, human trafficking, labor exploitation. So basically, I found myself researching anything and everything where there's human suffering. But I come from a more of an engineering or optimization or supply chain management perspective to these problems. I'm not a humanitarian lawyer, or I'm not a humanitarian philosopher. So I try to solve human problems or humanitarian problems from a engineering perspective, I guess.
Awesome.
Felipe, what about
Great.
you?
I have I also have, Renata mentioned, an engineering background. I studied telecommunications, and then I did a master's in aeronautics engineering. Then I joined one of the biggest aircraft manufacturers in the world with the Brazilian Embraer. But then I was hit by 2008 crisis, and a little bit before I had been in literature festival in Brazil, international, who's one of the presenters was a former soldier boy from Sierra Leone, and I watched him saying an excerpt of his book, and I met him. I saw him very close, and I said, "Wow, this guy suffered a lot. This guy passed through things that I have never imagined that I could face or challenge that." And me, I raised in a structured family. We had access to healthcare, to education, and so on. And I think that I should do something different for the world. And then that's how I reached the MSF, Doctors Without Borders. I wrote an email. At that time, I was already had enough professional experience. I could speak four languages, and I said, of course, this profile is interesting for us, because I think that the one advantage of being an engineer, as you mentioned, is we learn how to learn, but also on engineering, we learn a lot on how to learn. I think that passes from our all the undergraduation, that we have to be a self learner in a way. Of course, the professors can guide, but we have to put a lot of effort. And then I wrote them and that passed through the recruitment process, and then I joined. I mean, no previous, I would say, academical experience or reading anything related to disaster. It was just like the wheel of thinking, having a former soldier boy in Sierra Leone. That was just not luck as me to be born somewhere else and not have the same access to education or healthcare and so on, and living and having to grow up in a conflict zone. So, and I thought myself, okay, maybe I shouldn't be putting too much energy on business jets for some few people in the world that can buy, but maybe I could do something a bit more helpful for the world. And that's how my humanitarian career started. That was 2008 when I did my first mission in Colombia.
Well, that's wonderful. Thank you so much. So, anyone want another question, or can close the session? So it was a beautiful session. Thank you so much. I appreciate it. I'm glad you guys come to the Humanitarian, because we need so much this kind of knowledge and research and action. So unfortunately, I think we never have so many operations inside today, but I think we still, a lot of people have no access of any kind of humanitarian service. So we're still very behind of the needs, but that's, a working process, we can say. So anything else you want to say before we close the session? No? Okay,
No
so
questions.
thank you very much. I appreciate. I'm going to stop recording. And thank you.